Bismillahirrahmanirrahim. My pleasure and honor to introduce our last speakers of the day, last but definitely not least, for a really evolving health concern. First time it's being presented in this conference, and I think it's probably not going to be the last, unfortunately. Talking about climate change and how that's affecting our health care. Dr. Jamila bin Yamani is a PhD in chemical engineering and the director at Salesforce, director of climate and energy. And Dr. Ammar Yamani is a pediatric anesthesiology assistant professor of medicine at Baylor College of Medicine. So please welcome on Dr. and Dr. Yamani.
Bismillahirrahmanirrahim. First, it's not on. Bismillahirrahmanirrahim. First, I'd like to thank SBMA for allowing us this opportunity. My name is Ammar Yamani. I'm an anesthesiologist with Baylor College of Medicine and specialized in pediatric anesthesiology. And my co-presenter is Dr. Jamila Yamani, happens to be my wife. She is a PhD in chemical engineering and environmental sustainability, and she is the director of climate and energy at Salesforce. And so today we're going to offer you a small window into a conversation that has been evolving in our marriage for the last 15 years. And this is the crossroads where our professions have met. So we're going to discuss the new vital sign, how climate change is reshaping patient care. Next slide. We have no relevant disclosures to this talk. So I want to ask everybody, I haven't seen this yet, so I'm going to be the first to breach it. This is the DeLorean, okay? And this is a metaphor I want to instill in you right now. The amount of energy it took to go back to the future was 1.21 gigawatts. And I hope everybody remembers that, because just know it takes 100 watts, 60 to 100 watts to power one light bulb. This took millions of light bulbs to go back in time in a fictional setting. What I want to tell you by that is that it takes a lot of energy to acknowledge, learn about climate changes and how they are affecting our care. It takes a lot of energy to adapt and then mitigate these problems. So the human body is made up of multiple organs, and when one fails, the whole body fails. So, I have cardiologists, nephrologists, all my pulmonology fellow friends. You know when the heart starts pumping, the brain goes, the heart goes, the kidney goes. And along those lines, Jamila will talk about climate change.
The Earth is no different. The Earth has regulatory systems just like the brain, except in environmental science we call them planetary boundaries. There are 9 planetary boundaries. One of those is climate change, but it also considers flow of water, flow of nitrogen, phosphorus, potassium, atmospheric chemistry, airborne pollutants. And today we're going to talk about climate change specifically, but these are interrelated, interconnected. So failure in one will result in failure across others. I bring this up because I work in sustainability, and I often get asked about things like microplastics or PFAS or air pollutants. And what I want to share today is that these are interconnected challenges, and while we'll talk about carbon dioxide and emissions, as again, these are related. So we'll start with an overview of climate change broadly. What is it? Why does it occur? What are the primary drivers? And how perturbations in climate, how changes from the steady state impact global ecosystems. Ammar will cover the direct and indirect health impacts of climate change with 3 specific examples: heat, air, and vector-borne illness. We'll talk shortly about what we can do about it and end with a call to action. The primary driver for climate change is carbon dioxide, or CO2. Nearly every human activity that we participate in emits CO2, from driving our cars, to powering light bulbs, to growing food, to deforestation, wildfires, and even healthcare, the anesthetics used at a hospital, development of pharmaceuticals. To balance these emissions, which was this blue arrow, trees and oceans absorb CO2 into the geosphere, into the earth around us. And in pre-industrial times, these 2 flows were balanced. We had Pre-industrial times, these flows were balanced, and we had a steady state concentration of CO2 in our atmosphere. This is important because carbon dioxide traps heat at the atmosphere with something called the greenhouse gas effect. Heat is radiated from the sun to the surface of the earth and maintained at the surface of the earth through CO2. In present day, we have an imbalance in these flow. We are participating so much in these fossil fuel burning activities. We fly more than we used to. We drive more cars. We do more. We need more. We develop more. At the same time, we're sacrificing nature. Deforestation is occurring, and our ability to draw down CO2 from the atmosphere is also changing. An imbalance here causes an accumulation of CO2 in our atmosphere. This accumulation of CO2 traps more heat at the Earth's surface and results in climate change. Here is a graph that demonstrates in Mauna Loa Observatory in Hawaii that measures the amount of atmospheric CO2 over the last 50 years. And we can see a steady increase. This is one of the foundational pieces of data and evidence for climate change. And here you can see an increase in CO2 concentration that we measure in parts per million. And that's directly connected to an increase in global temperatures that we measure in degrees Celsius over pre-industrial times. That's an important number that I'll come back to in a moment. And there are two ways that we talk about climate change. The first is climate mitigation, and that is my professional focus. How do we fix the problem? How do we reduce the size of that blue arrow? How do we increase the size of that green arrow? But another increasingly relevant and important part of climate change is climate adaptation. How do we live with the conditions that we are creating for ourselves, whether it's resilient infrastructure, whether it's how it's going to impact human health, food systems, water systems, and that's going to be the focus of our conversation today. So we mentioned that the atmospheric temperatures are increasing due to increasing levels of carbon dioxide in our atmosphere. This warms the air and changes the jet stream. आप लोग इस सगला जो you have say on TV when we watch the weather, they show the jet stream that passes across the United States, for example, that moves weather systems across. Because we've perturbed the steady state of the planet, now we're seeing an increase in variability of that jet stream, of those temperatures, and that results in changes in temperature, in precipitation, in atmospheric pressure. And while these may seem benign, it's just the weather, the reality is that this manifests in extreme climate events, drought, extreme heat, hurricanes in Florida and California, Texas, wildfires in California. And the consequences when we extrapolate are horrific when we increase the global temperatures 1.5 degrees C beyond pre-industrial times. Now, we've talked a lot about, in our community, this 1.5 C degree number. The reality is we will exceed 1.5 C degrees over pre-industrial levels for climate change. We're actually on track to almost 3 degrees C. So we should know we are experiencing some of these, from lethal heat waves and droughts happening in different parts of the world, which result in a loss of animal life and animals becoming extinct, irreparable damage to ecosystems like the Great Barrier Reef. This turns into a shock to food systems, grain, corn, rice, crops that nourish all of us, and ultimately is going to result in a global GDP loss. Up to 20% of GDP will be lost to climate change by 2050 if we don't do something now. But these impacts are not years away. We are already experiencing them today. Over 50% of heat-related deaths can be attributed to anthropogenic warming that's directly tied to activities that humans are participating in. Humans are doing all of those activities I showed you at the beginning. In addition, floods across the world are impacting almost 20% of the world's population, from Texas all the way to Pakistan and anywhere in between. And we'll talk a little bit more about this in a moment, we're seeing an increase in particulate matter in the air that's resulting in almost 2 million deaths annually. And those of you all may know, particulate matter is closely tied to morbidity and mortality in the literature, and we continue to see that exacerbated by climate change.
But climate change isn't only an environmental problem. We see it in human health issues affecting people locally here, right in front of us, and globally. And it will continue to affect our patients and how we manage our patients. So Just like Jamila had mentioned, this is just a small piece of the pie. And today we're going to focus on three specific climate-related issues and how they affect healthcare, our healthcare management of our patients. So heat, extreme heat conditions, and again, this is a very superficial touching on what is the problem and then opening this up to an opportunity to advance on it. Heat stroke, exacerbation of chronic conditions such as a lot of literature right now on patients on antihypertensives and how the risk of dehydration, morbidity, and mortality has increased over the last few years. Air, poor quality related from PM 2.5 that's released by, again, everything that we're doing to advance. Wildfires, humidity, hot air and versus humid air conditions, increased allergens as a result of these changes in climate that exacerbate asthma, COPD, cause more incidences of our children who have these predispositions. And then finally, bugs. Again, speaking broadly, heat, floods, all these climate changes cause a shift in the organisms that carry some of these infections and diseases, and then we see them in unseasonal moments compared to historic norms. So again, vector-borne illnesses, unpredictable respiratory viral seasons. And then, again, three pieces of a big pie all combine to affect systemic changes in our practice. You'll see it in your workforce. You'll see it in hospitals shutting down with weather-related issues. You'll see it in your own staff calling out sick for random things that were not as common in the past. So an increasing frequency of heat waves have caused an increased incidence of heat-related deaths. So this chart right here on the left looks at a 60-year scope of the number of heat waves experienced in the United States and the number of days those heat waves last for. So initially you see a linear growth, but then at the end, in the last 20 years, you can see this kind of sharp uptick in the amount of heat waves we're experiencing and the duration that they're lasting. So since the 1960s, heat waves now cause about hospitalizations and cardiac issues 3 times as much as they did back in the 60s. And then heat-related deaths over the last 20 years or so has increased by 117%. And then between the last 20 years, we've seen over about 500,000 heat-related deaths each year. And again, this is not just, morbidity is the other part that it's affecting. So with the increase in heat-related events, we see an increase in hospitalizations. And this study is looking at a sample of ER visits in our region, the Pacific Northwest, over in a 1-month span. And this orange line you see at the end is 2021, and the gray line is the local data and also the national data for the same time. And you can see over a matter of 2 years, the amount of uptick in ER visits for the same duration has gone up significantly. And then, this Virginia study looks at 4 years of heat event days, which means basically compared to historical norms, days that are extremely hot. And we saw an increase in those heat event days of, in addition to the baseline, 400 plus ambulatory care visits, 7,000 additional ED visits, and 2,000 hospital admissions. And this affects us in our community. When we gather in our mikats, we have medical camps set up, but what we're seeing is that India, Pakistan, where our majority of our mu'mineen reside and we recongregate, are experiencing these extreme heat conditions more frequently as well. That's resulting in deaths in the local community, and it's something that we now in our medical camps have to anticipate rather than react to. So I'll segue for Jamila into the air part now.
We talked a little bit about heat. Now let's cover air. Air quality impacts certainly exist with climate change across 3 specific examples. The first is allergens. Warmer temperatures mean prolonged and changing pollen seasons, allergen seasons. Increased dampness due to floods can increase the amount of mold spores and fungus that we experience in the air. This is directly related to the higher humidity that we experience due to increased precipitation and changing weather patterns. This atmospheric chemistry also creates enhanced PM 2.5 formation. PM 2.5 are particulate matter that are 2.5 microns or smaller. That's particularly important because that size of particulate matter can be inhaled and enter the bloodstream. And the negative health impacts are very well documented for PM 2.5. Wildfires in particular inject a large amount of PM 2.5 locally when they occur. They also emit black carbon and VOCs, which are harmful to human health.
So this clearly has implications for respiratory health. And with this increase in allergens, the way we see it the most commonly in the pediatric world is that we have these atopic dispositions, these children with these triads of allergies that were not normally there. People have other children that didn't have these issues. Asthma onset, adult asthma onset, hypersensitivity pneumonitis, so not related to infection. And then hot air versus humid hot air and how that impairs mucociliary function, causes a chronic inflammatory state, and again, can lead to decompensation in respiratory status. And then wildfires. Again, we live here in California. You all live here in California. You see this quite often. This most recent event really shut down hospitals, not just for the time period where the wildfire was raging, but this lasted, and the effects were seen, again, in our perioperative world for months, almost years afterwards. So again, what are those specific issues? So as Jamila had mentioned, PM 2.5 are these very small microns. They're in the air, they're allergens, they cause a lot of inflammatory response. And this cartoon here on the right, on the left, shows how this recovers after being insulted by the PM 2.5. You can see a huge flood of inflammatory mediators in the lung. And then on the left side here, you see that this is a study looking at a 4-year perioperative outcome in Utah, where they retrospectively looked at complications in the peri-op time related to respiratory problems, and they aligned it with PM 2.5. And you can clearly see that as they saw an increase in PM 2.5, those complications went up in the perioperative realm. And we're adapting. So again, I'm talking to you from my standpoint of a pediatric anesthesiologist and what I've seen over the last 10 years. We used to not give albuterol prophylactically to every child who came in for a tonsillectomy or adenoidectomy, which, all you can account for that this is a very common bread and butter surgery. We've had to adjust because we started seeing so many complications in the postoperative period, not related to infection, just related to these underlying patients having bronchospasm, laryngospasm. And this evidence was kind of retrofitted to treat our problem. And then the same thing with airway management. And if you all are familiar, we use endotracheal tubes classically for tonsils and adenoids. However, historically, we've used laryngeal mask airways. And we went back and looked at it, and we found a lower incidence of postoperative complications after using the LMA instead of the ET tube, again, accounting for these changes in our environment.
Finally, we'll talk a little bit about bugs, and I think this is one of the most interesting impacts of climate change on human health. It's changing the landscape for infectious disease transmission across 2 primary pathways. The first is temperature and precipitation. Warmer temperatures allow vectors like mosquitoes, ticks, fleas to survive longer and in newer geographies, and these increased temperatures accelerate pathogen replication and transmission. Extreme weather like floods create new breeding grounds for these vectors so they can interact with human populations. We also see habitat and range shift. Vectors that were previously, conditions that were previously unfavorable for these vectors are now found in these spaces. Los Angeles is a great example. When I grew up here, we didn't have any mosquitoes. Now, 10, 15 years later, there is a prevalence of mosquitoes, and that is a direct result of climate change. And what we're seeing is exposure of human population to newly endemic diseases. These new vectors, new diseases are interacting with human populations in a way they haven't before, which is one of the etiologies of how COVID-19 may have come to be transmitted to the humans.
So we'll carry that theme over into tick-borne diseases. And this timeline on the left shows the discovery of various tick-borne diseases in the United States. And obviously, with time, science, research, people living longer, we've seen more of these diseases. But I'll specifically point out here between 2000 and 2020, a huge uptick in the amount of newly discovered tick-borne illnesses. And that's a direct result of us expanding, industrialization, and these climate changes causing these vector-borne illnesses, the vectors that are carrying them, to move into climates that they weren't normally and locations that they weren't normally. And then this chart on the left shows the increase in Lyme disease, which again, we all know, we all studied, to death in medical school on your USMLE Board 1 exam. You saw this question all the time. But what I will point out is how it has risen over the last decade. So just a quick case for you all to kind of think about it a little bit more. You have a 12-year-old boy who's in northern Michigan, comes in the middle of July with headache, joint pain, expanding rash on his thigh. We all know that's pathognomonic, right? We all know that's Lyme disease. But the problem is he's in northern Michigan. And historically, we've always learned Connecticut, that's the one that always shows up on your board exam. This light beige color shows the historic distribution of Lyme disease. And then the dark beige shows the expansion over the last 4 to 5 years. Second case we'll talk about is a 2-year-old who comes to your clinic or the ER with a high fever, coughing, wheezing, 2 days after a Halloween party at his preschool. Tests are negative for SARS-CoV-2, bacterial pharyngitis. So what is the most likely diagnosis? And for the sake of time, yes, it could be a couple of these, but what we're seeing is that it's RSV season, and historically, again, this is looking at a 5-year span, we've seen peaks that would occur in our classic winter seasons. So here you see January occurring in the 2020 time. Now you see a big kind of plateau and flat line here because of COVID, but then when we all kind of got back out, you can see that these spikes are now happening earlier and earlier in the year. So we're seeing October, and June even in certain situations. So we're at a beginning of a new era, and we have a lot of opportunities to adapt our practice. And so this is where we'll try to touch on some opportunities where we can adapt and meet climate change where it is, because the mitigation strategies to avoid it are a whole thesis and a whole dissertation in and of itself. But heat, having more accessible diagnostic tools to monitor for heat-related illnesses. And if you've been following a lot in the news, we had a talk, the cardiovascular folks gave a great talk on wearables. We have these devices readily available to us that are monitoring oxygen levels, heat, temperature levels, skin levels. How can we apply those to help patients who are out in the field? And you see construction companies now utilizing this to monitor their labor force to avoid, anticipate and prevent these problems. In the air quality realm, how can we look at PM 2.5 a little more closely and literally incorporate it into one of our vital signs? And that opportunity, we've done the retrospective research. Now when a patient comes into your clinic, can we use these advanced algorithms and these advanced databases to kind of collect the PM 2.5 levels and correlate it, just like we would a growth chart for a patient of when their symptoms are worse and how it relates to PM 2.5. And then last, bugs. Again, this is a very broad and important spectrum, but we're never going to be able to anticipate and adapt if we're not collaborating with the right people. So this is for all our epidemiologists, our infectious disease folks, talking to your primary care team, about how to anticipate and better manage some of these unseasonal infections that are happening.
We talked about specific examples on heat, air, and bugs, and I just want to cover for a moment some of the more systemic impacts that we're going to see from climate change. The first is around collapsing food systems. Global warming is going to threaten food security across the globe. Here in the United States, we are an affluent community, but in developing economies, that is certainly going to be a challenge. Alhamdulillah, akamola ni ne'mat che ki humne sagla ne FMB male che, but there will be impacts that we have to consider in our own community on how we manage food insecurity across the world. Climate change also exacerbates health inequities. I heard this in the AI talk, and I think it's also very relevant here. Climate events magnify inequities, especially because they're lower socioeconomic geographies have less resilient infrastructure. They are more impacted by climate events than more affluent communities. We discussed a lot on how climate events overwhelm health systems. They put pressure on hospital systems that are already fragile. We discussed this in the context of heat events. It's also true for floods. It's also true for wildfires. How are we going to manage that? And when we bring all of that together, climate change has a major economic strain from catastrophic events. $150 billion in the United States alone is the cost of climate change, not including the cost of lives lost or that cost of health. Now extrapolate that to the world and in the future. It's a $1 trillion problem that we must address. Climate change is happening now, and it is impacting our health. All of you as practitioners are already seeing these shifts happen in health patterns. I haven't taught you anything new. We've talked about things that you're seeing. What we're offering is context so that you can understand how this will continue to change, how it will continue to evolve. And we can work together to manage these impacts on human health. But, and I have to end on a positive note because I've dedicated my life to working on climate change and climate mitigation especially. Failure to address climate change is not a foregone conclusion. We can still do something about it. And I want to leave you all with a call to action. Make sustainable choices because 50% of mitigation, 50% of solving the problem is related to individual choices that you and I make. So in addition to cost, health, convenience, make climate a part of your decision-making criteria. You will find in many cases, health and cost are positively correlated with climate. This can be something as simple as meatless Mondays. There is a huge climate impact to consuming beef. If you move to a vegetarian diet for one day of the week, that's probably the most significant factor of your own carbon footprint. Rainwater harvesting, reducing waste. These are things that Akamola already informs us to do as communities, and there are very positive climate benefits to pursuing these avenues. Or bringing ideas to your workplace. You know, if you go in with a mind to reduce waste, to address climate, make it a consideration, together these small changes can have a larger impact.
And Jamila brings up an excellent point, and this is what inspired me to get involved, was that when I joined my sustainability committee to lead it in my hospital, I had to come up with something simple. It was as simple as, you know, multiple suction canisters were being used by different specialties in one OR. We talked about the problem, we looked at the cost, we looked at the savings that would happen, and we looked at the plastic waste that it would save. And immediately we saw at least a $100,000 decrease in our annual budget for suction canisters. Now you can sell that to your manager, your leadership, but think about the tonnage of plastic that you're stopping from being used. So आखिर में दुआ करें कि खुदा ताला हमारा आका, हमारा रहबर, हमारा रूहानी यानी जिस्मानी तबीब सैयदना मुफद्दल सैफुद्दीन आका ने उमर शरीफ ने खुदा ताला क़यामत दिन लग दराज कर जो and working under the auspices of Umur Sehat, let us use all the teachings that Maulana has provided us. I mean, Maulana Rehbar Che, he has told us what we need to do to protect the world we inhabit. May we continue to thrive under the guidance and dua of Maulana Mufaddal Saifuddin Aka, Tawallah al-Musharrif ila Yawmiddin, and we'll hand over the next part of our speech to Qaizar Bhai.
Shukran, Jamila bin Ammar bhai. I have a proposition and hypothesis, and let's test this out in the next 10 minutes. I think the way we are designing our cities and our buildings are not only hurting our environment, but they may also be killing us. Jamila bin Ammar bhai provided all of the statistics. The one that I want us to focus on this afternoon, is that globally, carbon emissions, CO2 emissions, about 37% comes from buildings and transportation. Globally, akka world ma. America ma is 62%. Now, these are old statistics because I don't believe the current administration's numbers. So these are incredibly high. This is where my profession, this is where I focus all of my energy, working with the transportation and the building sector. And I think it's equally important. And I want to urge you, because मैं जा रहे काम करूँ छु हमारा profession में, I don't work with doctors. You guys are highly educated people. आपने जब आका मोला कही है कि ओला आपने सूटम साहब simple man आओ. What is the term? Arabi आओ. I work with a lot of Arabis. So my goal is to connect with them because you get it, but I'm trying to connect with them. So I'm going to share with you some of the information that we do. We're not interested in gizmo greens, letting technology solve it. Technology, and just as Delhi is trying right now to have helicopters go in and introduce artificial rain. Extremely expensive, extremely inaccessible, right? This is a platinum building in the middle of nowhere. It's a building that's green. It has a lot of technology, but it's propagating sprawl. It's encouraging other buildings to be like it. The only way you can access that building is by burning carbon by the automobile. 62% of transmissions coming from buildings and transportation sector. Ammar watan છે સિદ્ધપુર ઘણા લોકો ગયા છે. This is original green. This is how we used to do things. It's inherently green, and I'm just going to focus on the facade because under, you can spend half an hour just talking about how this building is green. Because you look at the facade, and you look that these are European-style townhouses, row houses, right? So the solar yield to cool any of these houses, because they share a party wall, is incredibly less. So they're using less carbon to cool themselves. You look at the windows. Windows આમ છે, there is a particular reason. અને ખાસ કરીને આપના lifestyle માટે. તમે નીચેની બારી બંધ કરો, ખોલો, so you get ventilation, you get privacy. You can sit down on the floor, because that's what we do, right? We sit down on the floor, you can get view outside, but it also lets the air circulate. And you open the window on the top, hot air can go out. This is technology that is cheap, that is accessible to everybody. Yet we have lost it. We have lost it in a world of industrial civilization. So the question is, how do we share this wisdom? How do we continue this sharing of knowledge base, of experience that we have to the next generation in buildings? And the proposition that I want to suggest to you is the nature's way. I mean, आप लोगों doctors show, you know how complex the DNA system is. Incredibly complex. Yet, our entire human race relies on two DNAs coming together. Now, can you imagine meeting somebody and talking DNA? No. All you need to do is attend Teen Stuff Free, Taaruf program, get attracted to somebody, nikah thai, shadi thai, exchange of DNA, right? So you have a very simple process, a very complex process of passing on DNA happening very beautifully, right? So that's how we transfer wisdom. And in transportation and building. And I want to focus again on this. If we design our streets for the automobiles, right? You're not going to encourage people to walk. 70 or 80% of the street, in most cases 90%, in some cases 100, is dedicated primarily to movement of automobiles. That's where the carbon emissions come from. Majority of the carbon emissions come from automobiles in this country. We know that a 5-minute walk helps various components of physical health and mental health. And I don't need to tell you. You can tell me and teach me about that. But we have that studied. Walking is an important thing. And I can tell you by my personal experience. Mumbai, when I was growing up, I walked half an hour to the station, school jao, pachi wahan half an hour. I got my daily exercise. Daily exercise is integrated into your lifestyle. It's not something that you have to go to the gym. Connectivity and physical activity are incredibly. A grid pattern. This is how we used to design Sidhpur, how we designed places 100 years ago. This is what we're doing right now. Amasi mane અહીંયા મેં રહેતો હોય અને મને જવું છે સ્કૂલ as opposed to અહીંયાથી મને સ્કૂલ જવું છે. There are various ways. It's a grid pattern, right? Here, I'm forced to get on the local street, then get on the secondary arterial, into the primary arterial. Is it any wonder our primary arterials in our cities look like this? No. They don't encourage walking. They don't encourage exercise. So what we are trying to suggest is design of complete streets. And my daughter has got her face covered. But safer streets these are streets where you have people walking. The frontages of the buildings are lined up to provide comfortable, safe, and very engaging environment. And as we know, walking helps physical and mental health. It curbs emission, because the goal of transportation is not a trip. Let's think about that. It's not a trip. What is it? It is access. Agar mane access mara bazuma masjid che, main masjid na bazuma rahi rahu chu, I don't have to drive, and I'm walking. Problem solved. It's not trip. Every person contributes 10 trips into our daily streets. 2 of those are to work and forth and back. The rest of the 8 trips are trips to the grocery store, to the library, to all of the other things. So imagine if you're living in a compact, walkable environment. How many of those trips are you cutting off? And by the way, I've not talked about fiscal issues, which a lot of countries, a lot of cities here and county is facing. Fiscally, this produces more revenues for the city. Just to give you an example, a big box like Costco, you compare that with a small Main Street building that sits on an 1/8 of an acre of a lot. It outperforms the Walmart, the Costco's, not once, not twice, in many cases 18 to 20 times. So why are we building that? That is not a walkable environment. Why are we not building more of this, which is fiscally positive? Now, we mentioned about carbon emissions. And if you have one takeaway from this, just remember, plant trees. Because Los Angeles, Amna, there's a program to plant 1 million trees. And they're giving away trees. Up in a call, so if you're staying within the city of Los Angeles, they'll come deliver 6 free trees to you. And the whole purpose of that is this. It purifies air and water. This is a city we worked in, South Pasadena. All of the stuff, bad stuff that gets cooked in the air in Orange County, because of the air pattern, comes here into LA. And because of the mountains, it gets trapped into the cities where I work, which is in the San Gabriel city. It has the worst air quality, except in South Pasadena. Why is it that way? Trees, they make a difference. They absorb the pollutants, they reduce the urban heat. Places in this street, if you compare it to another street, it's 20 degrees cooler here. You've solved the urban heat problem. These are things that are easily accessible. Apne kari sake je. We don't need to rely on any technology to come and say, okay, you do this, that's expensive. How we design the buildings, and this is sort of a trailer. This is not even a tip of the iceberg. There's a lot of body of work behind this. But if you think about, if you're going on an escalator to go on a 24-hour fitness facility, to get on a Stairmaster, that just doesn't make sense, right? Or look at this. But here's Belgium, and this is done in India. Kanpur Madhya Uche, where the subway stations have music, so you encourage people to take the ride. You design buildings where the entrance, the stairs, are not tucked in the back, but right there in the middle. You encourage people to do the right thing. And that is the essence of what our practice is, what we've been doing in the cities around, is to make it easy and accessible, taki badha, not just a few that are planners or that are doctors, but badha ema engaged thai sake. And that's what my message and what my appeal to you is. Ki aap logo, you're doing great work, and this is something that's very familiar to you. I need only 2 minutes. Clinical intervention, this is where you guys work with, right? One-on-one. This is where I work with the larger population. In the built environment, working on socioeconomic issues. And I think this is where we can, having you guys help us here in the upstream environment is where we are seeing a lot of progress being made. Bringing these people, bringing your level, because there is nothing in a public hearing when you hear from a doctor, tame logo ubha rahi ne hum karso, this is why we're doing it. There's a health and safety, or a policeman. ये लोगों को आवी ने कैसे पची ये लोगों को planners ने बैठा दिए तब बैठी जाओ भाई. This is the health safety issue that takes paramount. I mean, that is the level of respect that your profession has, and that is why we want to engage you in this level, the population level, where we can have the most impact. That's my message. I welcome any questions or any feedback.